All right, so we'll go ahead and get started here. If you'll go ahead and move over to the next slide. All right, thank you everyone for joining the webinar today. I'm just going to go over some brief housekeeping items before we get started, and then I'll pass it over to our presenters today. So you'll notice as you are signing in that all lines have been muted for the duration of this training. If you do have a question, feel free to put that in the chat panel at any point in the session today. You should see the chat panel to the right of your screen, and you can open that up and put a question in there throughout the session today. This session is being recorded, so a link to view will be sent out shortly after the session today. And then finally, if you do have any questions, in addition to putting them in the chat, you can email either of the emails on the screen there. If it is a technical question, if you're experiencing any difficulties signing in, you can email training@mslc.com, and I'll be monitoring that throughout the session today and can help with any technical issues there may be. So with that, we'll go ahead and move on here, and I'll pass it over to Matt to get started.
Thanks, Maddie. Welcome, everyone. This is our annual training around the application. We'll touch on the agenda here in a moment, but I do have Jennifer Reinheimer and Charlotte Lesky here with Myers and Stauffer to take us through the technical components of the application. We have some updates in Qualtrics we're excited to share with you all and to make sure that you are comfortable with today. And as far as submitting your application as well as your documentation. If we can go to the next slide, please, we'll go ahead and just discuss how we're going to flow through this training today. I'll touch on briefly the program, but then we'll dive right in and go through the setup in Qualtrics, where we've made some enhancements and improvements, as well as discuss the new added feature around file uploads, which is available in Qualtrics. We'll do that as we have done in the past with screenshot overview to let you really see each section and understand the important pieces there as we talk through it. And then after we get you comfortable there, we'll go through a live demo so you can see it in action. From there, we'll hand it over to, stay on the agenda, please. From there, we are going to then hand it over to Jennifer just to talk about the preliminary review process and the appeals process, as well as some technical information around documentation related to those. We'll wrap up today with just discussing the changes that were in the application. They were minimal this year. We want to make sure you are aware of those as you're completing the application. Keep those top of mind. And then just some brief updates around our committee work, and we'll close the training. So we can go to the next slide, please. And the next slide, thank you. Sure, you all are aware joining this presentation, but we are discussing the application for the Nursing Home Pay for Performance program. And this is a voluntary program, but it is one where you are able to earn supplemental payments. So the performance in this program is not just something we score, it actually is tied into payments that homes receive via supplemental payments through our provider fee program. And so this is an opportunity for you to showcase the work that you're doing. The scores you get, anything you're doing in this program that allows you to get scores, of course, over 20 is makes the home available to receive payment. That's going over and above, and it's showing performance and actually showing high levels of quality and innovation within your homes. So we're excited that you're all here and excited that you participate in the program. We think it's a very important program for our state and one of the best in the country, we think. And your participation, I think, has created a culture within our nursing homes that we're proud of here in the state. Myers and Stauffer, who is helping with this presentation today, helps administer the program and the operations side of that, as well as doing the evaluations and scoring for our applications. And with that, I'll just hand it off, and I think we'll go ahead and dive into why we're here today to cover making sure you're all comfortable with Qualtrics, the new features around file uploads, and making sure you're all comfortable with that format before we launch the application here coming up soon. So with that, I'll hand it over to Charlotte and the Myers and Stauffer team. Thank you.
Thanks, Matt. So my name is Charlotte with Myers and Stauffer. And for those of you that were involved in the application process last year, Qualtrics may be familiar to you, but like Matt mentioned, we have made some improvements and some changes. So we're just going to walk through those today. It's set up mainly to mimic the application in the Qualtrics software. So we'll go through the prerequisites page, each of how the performance measures and the scoring are going to be entered, how documentation will be uploaded, any additional tools that are available within the system. And then we'll walk through the final attestation and submission process before we do a live demonstration, so you can see exactly how you'll go through those processes. Next slide, please. So for those who aren't familiar, Qualtrics is a web-based platform that will be used to collect the data and the performance scores for the 2026 P4P application. This year, we are also going to be collecting all of the supporting documentation for that application also within Qualtrics. So it will not be like last year where you have two separate platforms. The application process will all be in one spot. So we hope that that's a bit more convenient for you. The only thing that will be in a different location is going to be some of the appeals process, which Jennifer will walk through later in the presentation. So each facility will be emailed a personalized link for their Qualtrics application, and anyone within the facility that has that link will be able to either edit or submit the application. So I know that these slides and the recording of the session will be sent out after our training is concluded today. So for anyone who will be involved with kind of submitting information for the application, is just important that everyone is aware of how it works and is on the same page, so that there's no accidental early submissions from anyone or anything like that. The facility's name will be at the top of each of the screens within Qualtrics. So for those that are submitting multiple applications for different facilities, that will be a quick way to check which facility you're working on. And any edits to the application will be saved whenever you click the Save and Continue at the bottom of each page. And you can access that link at any time until either the end of February 28th or until the application has been submitted by someone within your organization. Next slide, please. So the first page that you will see when you open your link is going to be the prerequisites for the application. And before you move on to any of the other scoring processes, you will be required to complete this page. So you will be required to initial on both of the prerequisites, or you can submit an explanation in the right column as to why you cannot initial. And you'll need to submit some information about the resident satisfaction survey. Once you complete this page and click Save and Continue at the bottom, you will not be able to go back to it. So it is important that all the information is completed and is accurate on this page before you continue forward. Next slide, please. If the link goes live before January 2026, which I believe currently is not the plan, but in case it does, on the prerequisites where it asks for the average daily census for calendar year 2025, just enter the year-to-date average daily census there instead. Next slide, please. So after you've completed your prerequisites page and click Save and Continue, you will then see this table of contents, and this is the bulk of the application. You'll be able to see all of the different measures as well as the associated tools, resources, and final review pages here. You can click on any of these links on the table of contents to navigate to that page. And once you have reviewed and saved that page, it will appear blue on the table of contents and it will have a check mark next to it. And that way you can just kind of see exactly what has been completed in the application and where you stand. As I mentioned, also you can see in this example that we have our provider name at the top of the screen in blue. Next slide, please. So the table of contents can be accessed either by clicking the table of contents button at the bottom of each screen, or there is 3 blue lines at the top left corner of each page. You can click on those as well and scroll to the page that you would like to navigate to. The only thing that I would ask you to note is that some pages do have response requirements that must be fulfilled before you can move to the table of contents or save and continue. So if you're not able to or ready to complete one of the pages, Instead, click the back button, and that will allow you to move to another page instead. And we'll walk through that in the demonstration as well. Next slide, please. So this is what the table of contents will look like once it has been completed and you have gone through each measure and each tool and saved your responses on each of those pages. At this page, also, you can go back and review any of those responses. Once you click Save and Continue on this final table of contents, you will not be able to make any further changes to your application. Next. Oh, yes, Matt?
Charlotte, on that last page, if you had mentioned earlier that if I was on a page, I was like, oh, wait, that's for someone else to complete. I don't have that information. I hit back so that I can get back to the table of contents. Will that question, even though I didn't complete it, would it show blue here or would it not?
No, so it will only show blue here once you've clicked Save and Continue on that specific page. If you click back, or even if you just click the table of contents, it will not show as blue until you've clicked Save and Continue.
Great, thank you.
Okay, next slide, please. Okay, then first item that's going to be listed on your table of contents is going to be the resources page. And this page is going to include a lot of important information about the application and the process, as well as links to appendices and our contact information if you have any questions. There are some links to PDFs that are embedded on this page. So you can click those within the Qualtrics software and it will open those so that you can either download or print them to use throughout your completion of the application. Next slide, please. For each performance measure, you will see a page that looks like this. It will have all of the measure requirements and required documentation listed at the top of the screen. And then it will have a question asking if you intend to apply for points under that measure. And you must, for every measure, indicate either yes, you are going to apply for points under that measure, or no, you are not. Next slide, please. If you click yes that you intend to apply for points under a certain measure, you will then be able to see this table where you can view the points possible for the measure and assess your self-scored points. During scoring, you can either enter a 0 or the total number of points possible for that measure. If any other number is entered, so in this case, if anything other than a 3 or a 0 was entered in that gray box, it would not allow you to save and continue. You need to either enter 3 or 0 to be able to save and proceed with the application. Next slide, please. If you do assess any points for a particular measure, then it will allow you to upload your supporting documentation. So for each measure, you can upload up to 4 separate files containing your support. If you have more files than 4 for a particular measure, you will need to either zip files together or combine them. And each file uploaded can be up to 100 megabytes. So we will also go through the file zipping process in our demonstration for anyone that does not know how to do that. To upload a file, you can drag and drop it into the gray box or just click anywhere in that gray box and select the file from your computer. Once the files are attached, you cannot open them or delete them within the software, but you can replace a file if you click on the wrong one. So you just click anywhere else in that gray box and it will allow you to select the correct file. Next slide, please. To save each of these measures in your scoring, you'll need to click Save and Continue to advance to the next page, or you can click Table of Contents if you're not ready to save the page and jump to another measure. However, if there are any unanswered questions, you might get an error in red like the one below. So in that case, if you're not ready to enter your scoring for measure 2, you could click back instead, and it will take you back to the last completed page. And from that point, you can either use the table of contents button at the bottom or the 3 lines at the top to jump to the next page that you would like to work on. Next page, please. Additionally, if you entered or scored points on a particular measure but did not attach any supporting documents, you will be allowed to save and continue. However, you will see this little pop-up come up if you try to do that. And that is just a reminder that you have not attached any supporting files for that measure to support your score. You can bypass that by clicking continue without answering. Or if you just forgot, you can click answer the question, upload your files, and then proceed to continue. That is just if there are no files at all uploaded. If even one file is uploaded, you will not get that pop-up. Next page, please. So like in the Excel version of the application, we also have a few tools that can be used to assist you in completing your scoring for several of the measures, and we'll walk through all of those. The only one that must be completed for you to submit the application is the QM calculation tool. And that is just because those scores entered there flow directly to the measure. The others, if you decide not to apply for points on the measure that it's associated with, that will not be required before you can click submit on your application at the very end. So next slide, please. So we'll walk through each of those tools real quick. For the QM calculation tool, which as I said is the only required one, you do have a link to the quality measures and the percentile cut points at the top. You can click on that to open the PDF. And then all of the cells that are white will calculate automatically. So all you need to enter on this page is going to be your Q3 and Q4 Casper scores for each of these measures in those two gray columns. And then it will calculate the average, the percentile, and the points associated with that percentile. One thing I would like to point out is that at this time, the QM data cut points for the last 4 measures listed there are not available. If they're not available at the time that the application is sent out, no matter what you enter for those, you will receive 0 points on those scores. That will be recalculated by Myers and Stauffer once those cut points are received. So if you see it calculating 0 on those last 4 measures, that may be why. Additionally, as you go through and you calculate the points earned for each of those measures, it will rank them at the bottom of the screen. The top 5 scores will count towards your score on measure 7. So we'll rank those and then calculate the total points earned from the top 5. Next page, please. The trauma-informed care tool, all you'll need to do is select the trainings that were used at your facility, and then it will allow you to enter the number of nursing staff that took the training and the number that were employed at the home at the time of the training, and it will calculate the percentage of staff trained for you. Next slide, please. For the staff satisfaction survey tool, all you'll need to do is fill out those fields with the number of staff contacted and responding, as well as the name of the vendor. And then as far as who is administering the survey and how it was administered, you can select all of the options that apply, so up to 3. On that first question and up to 6 on the second. Next slide, please. So for the antibiotics calculation tool, the 2-quarter average will calculate automatically for you. All you need to do is enter your Q3 and Q4 scores. Please take note that the first line is going to be your 2025 facility scores. The second line is going to be the 2025 state average, and then the last row is going to be the 2024 facility scores. And then to receive points, the average for 2025 Q3 and Q4 must be better than either the 2025 state average for those quarters or the 2024 state average, or apologies, or the 2024 facility average for those quarters. Next slide, please. For the staff retention calculator, the only fields you will see when you first open this page are going to be A through C. You will enter your total number of staff on the payroll at the beginning of 2025 in field A, and then in field B, the total number that remained on payroll at the end of 2025, and it will calculate the retention percentage. If that retention percentage is between 40 and 60%, you will then see fields D through F to determine if there was staff retention improvement. And in that case, fields D and F will calculate automatically. You'll just need to enter field E, which is going to be the retention calculated for the prior calendar year. Next slide, please. For the staff turnover calculation tool, again, all of the fields that are white will calculate automatically. You will just need to enter your calendar year 2024 and calendar year 2025 figures for total number of nursing staff at the end of the year, number of nursing staff hired, terminations, and terminations less than 90 days after they started. Next slide, please. And the training attendance tool affects 2 measures. So it also can be used for the trauma-informed care calculations. If multiple trainings were issued throughout the year, to figure the average number of staff employed at the time of the training, you can use this tool to calculate that average. That can be used to calculate the % of staff trained. You'll see you can enter up to 8 instances of the training. If you only, say, had 2 trainings that were issued for the Center of Excellence for Nursing Facilities throughout the year, please do not fill out the rest of the columns that are unused. That will throw off the average. Only use the columns that you actually do need for the number of trainings that were held. Next slide, please. And the training attendance tool will also be used to populate the behavioral healthcare tool. So similar concept, you will use the number of columns that you need for the number of trainings that were held. Mental Health 101 was the only required training, and then you could choose to from Serious Mental Illness, Substance Abuse 101, or Addressing Co-occurring Disorders in Nursing Facilities. So once you fill out Mental Health 101 with the required information and it calculates your averages and sums, you'll select the other 2 trainings that the facility chose to take. And once you have selected those, you will see a table where you can enter that information. Next slide, please. And then once all of the training attendance tool information is entered, it will automatically populate on the behavioral healthcare tool. All of these fields that are in white will calculate automatically from the information that has been entered, and it will calculate the percentage of nursing and direct care staff trained. The only thing you'll need to enter on this page will be dates of training. Next slide, please. And new this year, we also have a final review page listed as the last item on your table of contents. And that summary is going to show the points possible for each measure, the score that was entered, as well as the names of all of the files that were attached to that measure. So you can see here in the furthest column, you can view the scores and the attached files. Once you've verified that those are complete, you will need to initial in that box. You'll only be able to save this page once you have initialed on each measure. And then once that has been complete, click Save and Continue. And we can go to the next slide. And then you'll see that final summary of your table of contents with all the items that should be marked blue. And there will be this message in red at the top stating that once you move on from this page, you will not be able to make any changes or corrections. So please use this opportunity to go back and review all of your information. And then once you move on from this page, you will be asked to attest to your answers, and only then will you be able to actually submit the application. So when you see the screen, it has not yet been submitted. This is your last chance to review. Next page, please. And if any of the required pages have not been reviewed and saved, if any of them are not highlighted blue, they will be called out at the top of this page as well, and you must finish those pages before you can submit the application. Next page, please. So once you've clicked Save and Continue on that final table of contents summary, you'll be taken to the attestation page. You'll need to enter your name, title, and the date in the attestation box. And then you will need to check off the statements below to attest that the information is complete and accurate. There's a final blue button that says Submit on this page. Only after you have clicked that blue Submit button has the application been submitted for consideration. Next page, please. So once you have clicked Submit on your attestation page, you should see the following screen with this message that says, "Thank you for your time taking the survey, and your response has been recorded." Until you see this page, again, the application has not been submitted and will not be considered. Next page, please. Also, once you have finished the submission process, you will receive an email that summarizes all of your responses to the application. That email will also include a couple of links at the top that you can click on for a more formatted, visually pleasing version of that summary. But this is just to keep for your records. If you do not receive that email within a few hours of submitting your application, it's likely that it may have been caught in spam. The email address that it will come from is noreply@qemailserver.com. So if you check your spam folder and it's still not there, please just reach out to us and we'll make sure that you get a copy of that summary. Next page, please. And finally, just a couple of helpful tips to help you troubleshoot as you work through your application. Again, data should only be entered in fields that are shaded gray. If there are fields that are white, generally those are fields that have an automated calculation built in that cannot be overwritten. Dates should be formatted as month, month, day, day, year, 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 year. So even if you have a month or a date in March, for example, you would enter that month as 03. And then if you have any calculations that are not updating automatically, if your cursor is still live inside one of the boxes where you've entered data, try clicking outside of the screen or outside of that field where you've entered that information, and it should update the calculation at that point. Do not enter any non-numeric characters, and that includes dashes and spaces in the fields for self-scoring or any of the fields that are used for other calculations. Decimals are fine. Calculations for the average number of staff employed at the time of a training, that will round to the nearest whole number, and then all other calculations will round to 2 decimal points. And then if you're having any trouble saving a page or moving on to the next page, check the screen for any error messages like this in red that may indicate why it's preventing you from moving forward. In this case, this error message may indicate that something has not been filled out that needs to be. Next page, please. Okay, so before we jump into our live demonstration, I see you have a couple of questions in the chat.
Yeah,
Yes,
our
Matt?
first question, Charlotte, is around file upload. And you'll probably touch on this a little bit in the live demonstration, but if I upload a file by mistake, can I delete it, or what do we need to do in the event that that happens?
So in the event that that happens, you cannot entirely delete the file, but you can replace it with a correct file. So say that you maybe, for measure 1, you're uploading your documentation. You upload your measure 1 support, and then you upload another file that maybe shouldn't have been attached. Since you cannot delete it, I would replace it with one of your other measure 1 support files, even if it's a duplicate. That way, only the correct files are attached to that measure. This also is a good point to bring up, that it can be very helpful to organize your files before you get started and save them in a specific place on your computer so that you kind of mitigate some of the risk of attaching incorrect files.
Great, thank you. And our next question is around measures in which we have a QAPI point, I believe, because that's where there's a 0 or there's a full points, but then there's also a 1 point. I believe that has been built in as one of the options.
Yes, so measures that allow for a QAPI point will have a separate line where you can enter scoring for that QAPI point, so a 0 or a 1. And that will be just below the normal measure points. So we'll see that in the demonstration as well.
Great, yeah. So in that instance, they would need to put 0 under the measure and then put a 1 in the QAPI box.
Correct.
I think that is all the questions we've received thus far.
All right, perfect. Then I will go ahead and jump into our demonstration. All right, so you should be able to see, this is our prerequisites page, and the first thing you will see whenever you access your application link. So as I mentioned, you're going to have your provider name at the top of the screen in blue. And then this page is also one where once you have clicked save and continue at the bottom, you cannot come back to this page. So, and we have a note to remind you of that as well. So if I try and save and continue without filling this out, it's going to go back and tell me you need to answer these questions and initial these prerequisites before you can continue. since otherwise you will not be able to go back and do so. So let's fill some of this out. So say I can initial for my resident satisfaction survey, but for some reason I'm not able to initial on the first prerequisite, but you would still like to fill out the rest of the application. In this case, I could enter my explanation in this text box, and then it will allow me to proceed. I'll enter the following information for my resident survey. And then I'm able to check all that apply for these next two questions. So vendor staff and internal staff may have administered the satisfaction survey, and then it may have been administered via phone and electronically. So now at this point, once I click save and continue, I'll want to go back, quickly review that all this information is correct and complete before I move forward to the bulk of the application. So this is our table of contents page. As you can see, all of them are still gray, so none of these pages have been completed yet. I'll start off with my resources page. And you'll see I have my table of contents up here. I can collapse that by clicking those three lines, or I can go back to the table of contents by clicking this button at the bottom. So this is going to have, again, some of the important information and requirements for the application. If you need to access the Excel version of the application or would prefer to fill that out first before the Qualtrics version, you can access this link to go and download that. I will say, make sure you are right-clicking and click Open Link in New Tab. That way it makes sure that you still have your Qualtrics application open as well. And then at the bottom, we also have embedded links for the application scoring summary and the application appendices. So if I click on that, it will open the PDF in a new tab, and I can review it from there or print or download it to my computer, whatever works best for you. So next, it's going to take me to the next item in the table of contents, which is the QM calculation tool. I'll come back to that once we get to measure 17. So at this point, I can just go to my table of contents and jump forward to measure 1. So you'll see we have all of our documentation and requirements listed at the top, and it's going to ask me if I intend to apply for points. If I try to save and continue without answering that question, it will note that I need to answer the question before I can do so. So if I say yes, I do intend to apply for points for this measure, then it will allow me to see the points possible and enter my score. So if I try and save and continue without entering self-scoring, it will ask me to fill out that field as well. If I try to enter, say, 5 points, which is not the total points possible, or 0, and save and continue, it will give me this error message as well. So if I enter 3 points, then it will allow me to upload my support for measure 1. So, and then we also have some additional instructions for zipping files on a PC or a Mac, if that is needed as well. So I'll go ahead and click to upload, and that's going to take me to my File Explorer. And what I've done is just made a special folder on my computer with all of my support separated out by measure. So I'll come to measure 1 and upload my support file 1. You'll notice I'm not able to open the file at this point, but it will show me the file name. So it is very important to make sure that you're naming your files clearly and concisely so that you know what you are attaching to each measure. And then I can go ahead and upload file 2. And let's say that I accidentally upload file 2 again. So in this case, I can just click anywhere in this gray area and replace it with file 3. And then once I have all of my files attached, I have my score entered, and go ahead and click Save and Continue, and it will take me to the next measure.
And
Yes, Matt?
Charlotte, I think on that last piece, there's something important I want to underscore for folks. So you notice while you're on the file upload page, folks, if you put a document in and you accidentally selected one from measure 3, you see it populate there, you can actually go in and replace that file with the correct one. in that box. I think once you save and continue and kind of move on, maybe you can come back and do that. So it's not like the delete piece, folks, that we were talking about earlier. You can't really delete a file, but it does, in essence, delete the file in terms of you can replace the file that's uploaded for that particular box with the correct file. But once you've submitted, and Charlotte, if I go past this page, can I come back and then I said, oh no, that was the wrong file. When I do my review later, can I go back to this page and then replace the file?
Yes. So I already clicked save and continue on this page. I can come back to it, click in here, choose the correct file if I need to.
Right. So that's basically your deletion option, folks. Is to, once you recognize that a file has been uploaded and it was, say, the file for measure 3 and you accidentally put it in measure 1, go back to that space in measure 1 and replace that file, and then it will be removed. I see that Mindy has a question. In the past, the files had to be specifically named. It seems we no longer have to do that in this system. That is correct, but the principles around how we were naming previously and notes, that's just to make sure that you and your team, as well as our review team, clearly understand what the documentation is for. On your end, it's helpful. Measure 1, minimum requirement, whatever you name it, to make sure that anyone who's uploading that is absolutely clear of what they're uploading and to where and where it belongs. And then the same applies to our review team. The clearer you can make that naming of that document for them and yourselves, the better.
Yep. Thanks, Matt. Are there any other questions at this point? I think I saw one.
So there are 4 documents that can be uploaded for each measure or for each submeasure. There are 5 submeasures, as there's still only 4 documents allowed. I think the short answer is yes, it's only 4 places where you can upload files for each measure, for all of the subcomponents that's in there. We did a review of our application, and generally the average we see across measures is 2 to 3 documents, so we put 4 boxes. But if you have a particular component of a measure that, say, it has 3 or 4 sub things, and you're not able to do that in one document, and you have multiple documents, that's where we would recommend you to use the zip file option, which is actually easier on your end in terms of organization as well. And so what you'd want to do is zip it under one piece of documentation. You're going to have 4 pieces of documentation, but for one part of the measure, you're going to have 5 documents there. Instead of combining them into one PDF, you want to keep them as 5. Create a zip file that says what that minimum requirement is that you're answering with those 4 documents, and put all those files in there, and then you can upload that as a single zip file. And Rhonda, that is correct. The question is, so we're now completing the application and uploading on files on one website. That is correct. Last year, you had to go to the separate Coltco to upload your documentation. And we worked hard with Myers and the Qualtrics team to be able to create this option for you all to be able to do all of this in one place.
All right. Go ahead and move forward then. Okay, so for measure 2, let's say that on this measure, you're not intending to apply for points. All you need to do is click no. You'll not see the scoring grid. You will not see the documentation upload slots. It will just be click no and move on to the next measure. And then measure 3, let's say we are intending to apply for points. But in this case, let's say that I have all of my measure 3 documentation put together. Let's say maybe I have 6 or 7 or 8 files. And instead I want to zip all of them together and upload them all at once. So all you need to do is just highlight all of those files that you want to zip together, right click, and then under send to, you should have an option for compressed zipped folder. And it will look a little bit different on a Mac, but we have that written out in the instructions as well. And then when I click that, it will take all of those files and combine them into one zip file. And I might go ahead and rename it to all of my measure 3 files. Then when I come to upload my support, click to upload. I'll find my zipped folder with all of my support files in it. And I should be able to upload just that zip file and move on to the next measure. Measure 4, let's say we are applying for points, but I forget to attach my supporting documents. When I go to click Save and Continue, I will see this pop up that reminds me that that has not been attached and asks if I would like to either continue or go back and make sure those are uploaded. So I'll go ahead and answer that and go back and upload my supporting files. And we'll use this as a note. Oh, sorry.
Yeah, Charlotte, as you're doing that, I think you maybe we're just getting there. So if I said I want to apply, I put the points in, then I realize, oh, my documents aren't here. I need to go get them. Should I be saying continue anyway, or should I be doing back? If I say continue anyway, does that give me the option to come back later and upload those files?
So yes, you can't go back to any of these measures at any point while you still have access to that table of contents. So we'll say that, at this point, maybe I need a third supporting file. And while I'm waiting to get that together, I can save and continue. That will mark this measure as blue on my table of contents. Or I can just click table of contents and you'll see it's not marked as checked off. And that's just my signal to myself. I still need to go back and finish uploading documents for that measure.
So I think that's our recommendation, folks, is if you're in there and you've got 2 of your files, and you've uploaded them and you've put your points in, but you need a third file and it just wasn't ready, don't hit save and continue. Go back to the table of contents so that it won't turn blue for you. I mean, I would do that personally just so I know that one's not complete and I need to make sure there's more work to do there. So I don't come back later and be like, oh, look at all these blues, I'm done. I think that would be helpful. And I think the same thing probably would exist then if I had not uploaded any documents.
Mm-hmm.
I know I want to score. I put the 5 points in. I was like, oh no, that document, I don't have it yet. I was waiting for it, but it's not here. I thought it would be here. It's not. I should hit table of contents or back and not hit, even though it'll allow you to say save and continue, say, do you want to continue without documents? And you could say yes, but it's going to turn that blue. And so you're going to have to keep an internal note then that measure, even though it's blue in your table of contents, is not complete. So your best practice there, folks, until you've really completed it and had all the documentation in there, hit back, hit table of contents, exit back out of there without saving and continuing so that it doesn't turn blue, so that you have a visual cue that there's more work to do in that measure.
Mm-hmm. Yes, absolutely. And if in some case you do accidentally go ahead and hit save and continue and have more to upload, that final review page, again, that will list the names of all the files that are attached for each measure. So that's also an important review step for you to make sure that everything has been submitted. Okay, so measure 4. I would also like to demonstrate, I know we got some questions about this. So let's say that on measure 4, I'm going through, I upload my support, and let's say I accidentally jump back and upload one of the support files from measure 3. So there's not a way to just delete this file. So what I would recommend in this case is just to replace it with a duplicate of one of the measure 4 files. That way there's just a duplication rather than an incorrect file being attached there. Go ahead and save and continue. So let's say that I'm not ready to complete measure 5 at this point. So at this point, if I try and click table of contents, you'll see it's going to ask me to answer the question before I can do that. So instead, what I can do is click the back button, go back, and it'll take me to the last completed page. And then from there, I'll be able to click table of contents and skip over to measure 6. For measure 6, as you read through the requirements on each of these measures, if there are any associated tools in the application that support the scoring on these measures, those will be bolded in the documentation requirements at the top of each page. So in this case, we're going to take a look at the trauma-informed care tool. So if I go back to my last completed page. Then to my table of contents, I can come down here to the trauma-informed care tool. And then let's say that these were the 2 trainings that I held throughout the year. But let's say maybe for each of these different trainings, there were a couple of dates that those were offered, and the number of nursing and direct care staff differed at each of those times. This is a case where you can use that training attendance tool to help you calculate the average that will then be entered on this tool. So go ahead and go to table of contents and training attendance. And then measure 6 is going to include these first 4 tables. So let's say that for training under Center of Excellence for Nursing Facilities, let's say I had a training on April 1st of 2025, one on June 30th, and one on July 2nd. There were 6 nursing staff at the first one, 5 at the second, and then 14 at the third. And then the number of direct care staff employed at the time of training for the first one, say it was 25, and the second, 32. Now this is a case where you'll see that my cursor is still active inside this cell, and that is why my average has not yet updated. So once I click out of that cell or into a different one, it will then go ahead and update the average calculation. Let's say 30 nursing staff are employed at the time of training 3. So we'll calculate the sum and the average, and that's what you're going to take back to then that trauma-informed care tool, which will inform your scoring on measure 6. Let's say I also had a couple of trainings for this program on November 30th and December 1st. And there were 4 in attendance at the first one and 16 at the second. 36 total employed at the first and 32 total employed at the second. So it'll calculate the average. Again, this average is rounded to the nearest whole number. And then I have these total sums and averages that I'm going to take back to my trauma-informed care tool. So let's go back to the table of contents, trauma-informed care tool. For this one, the total sum of nursing and direct care staff that took the training at one of those dates was 25, and the average number of staff employed during those trainings was 29. So it'll calculate the percentage of staff trained for me, and then I'll just go ahead and enter the dates that those were provided, separated by commas. And then for this training as well, our total nursing and oh, I see a question about entering a 2-digit year. To put it simply, there are some questions that require that and some that don't. The questions that require a 4-digit year are going to be the ones on the attestation, as well as the DON and NHA retention calculations for measure, I believe, 20. So if you get an error that says the date is not in the correct format, that will be why. For these training dates where you may have multiple separated by commas, they don't have to be a 4-digit year. Okay, so the number of total staff is 20, and the average number employed at the time of the training was 34. And those trainings were held on November 30th and December 1st. So I'll go ahead and save that and then jump back to measure 6. So based on my completion of that tool, I can indicate whether I intend to apply for points and the number, and then upload my associated support. So done, I can click Save and Continue. For measure 7, we'll say no. And then measure 8, we'll say yes, we're applying for points, but on this measure, it is broken out into 2 sections, so 8.1 and 8.2. And if I scored points under 8.1, that does not necessarily mean that I had to have scored points under 8.2. All right, and then, so once I've entered points under either 0.1 or 0.2 above, it will allow me to attach my support as well. Okay, measure 9, we'll say yes, and this will give you an idea of how the QAPI points will look in the system. So for the total measure, there are up to 4 points possible. However, if you don't qualify for points under the measure, but do qualify for a QAPI point, you'll just enter a 0 here under the total measure, and then enter a 1 for that QAPI point, and it will allow you to upload the support for that as well. Measure 10, we'll say no. Measure 11, we'll go ahead and say yes. And then an error will appear if you accidentally enter total points for the measure as well as the QAPI point. So we'll give an example of that. Say I have total 3 points for the measure as well as the QAPI point entered. I'll upload my measure 11 support. But when I try to save and continue there, it's going to give me this warning that I can either earn the full points under the measure or I can earn the QAPI point. I cannot earn both. So in this case, I'll change this to a 0, and then it'll allow me to proceed. Measures 12 through 14, we'll just mark those as no to move ahead. And then after measure 14, it will show you the total self-scoring points so far for the quality of life domain. So you'll have your points possible in the first column and then your self-scoring as well, and that will flow directly from all those measure pages that you've just gone through and saved. Any QAPI points will also be under the measure, just on their own little subline. Measure 15, we'll say no. Measure 16, we'll go ahead and say yes, since there are some changes to this measure this year. So for this measure, if you have earned any points under this measure, you're also required to fill out this table with medical transfer reasons and results. So let's say I've scored full number of points for both parts. And then what I'll need to do is enter the transfer reason. And that can just be a text entry. And I'll do that for all of these lines. And then I'll go through and enter the number of instances for emergency department stays, observation stays, and inpatient admissions. So go ahead. And you'll notice that as I enter each of those numbers, it's going to sum up the total transfers for reason 1, as well as the total number of transfers by emergency department, observation, and inpatient admissions. So we'll go ahead and continue filling this out. And it will continuously update those totals anytime you change or enter one of these numbers. So if I go back and change one of these, it will update the total as well. And then once that table is complete, I can upload my support for measure 16. Save and continue. Now we're on to measure 17, which, as you can see, involves the QM calculation tool. So I'll go ahead and go back to my last completed page so I can jump to my table of contents and select the QM calculation tool. Again, at the top, we have a link to the PDF with all of the cut points and percentiles. So if I click on that, it will upload that document for me. So I can see, and you'll see, of course, these last 4 measures are still marked as TBD at this point. So all I need to do is enter my scores for Q3 and Q4 in these 2 columns. And you'll notice that as soon as I enter both of those, it calculates 2-quarter average, the percentile, and then the number of points earned for that percentile. I'll continue going down the line. Notice as well that it is updating the rankings down here at the bottom as I go through this process. And then for these last 4 measures, even though they may not depend on what numbers I'm entering here, since we don't have that cut point information at this time. So you'll see that I'm going to earn 0 points for all of these measures in the system. And in those cases, it will just be recalculated by Myers and Stauffer on the back end once we have received that information. So you'll see we have our final rankings with the top 5 scores, and those will count towards measure 17. And that total of 11 points earned for each of these measures will flow automatically to that measure. So what we can do is go to our table of contents and measure 17. Say yes, we intend to apply for points, and then you'll see that all of those points from the QM calculation tool are automatically pulled into the system here. And it has the total applicable for the measure down here as well. You'll notice that there is also a separate point for the measure 17 narrative that goes along with this. You'll not be able to enter that here. You'll need to enter it above in the gray field. So if I earned a point for that, I enter it up here and it will be pulled down to this assessed points box. Then I can upload my support for measure 17. Next, we'll go to measure 18. We'll say, no, we're not applying for points under that measure. Measure 19, this one also involves one of the tools. So the antibiotic stewardship and infection prevention and control tool. We'll go ahead and go back, jump to our table of contents. And from there, we can access that antibiotics tool. And all that needs to be done here is just fill out the values for Q3 and Q4. So 2025 scores for the facility for Q3, say 4 and 5 for Q4. State average might be 6 for Q3 and 2 for Q4. And then the 2024 scores for the facility might be 5 and 7. So we'll calculate all the averages for you, and you'll just do the same for the catheter quality measure as well. So once that's complete, I can use that to then inform my scoring for measure 19. So I'll go ahead and jump back to measure 19 in my table of contents. So yes, I do intend to apply for points. And this one has a QAPI point available as well for both measure 19.2.1 and 19.2.2. So let's say that I earned the full points under 19.1. I earned the points under 19.2.1, but perhaps didn't earn the points under 19.2.2. So I'll enter there, but I'm still eligible to qualify for a QAPI point for stewardship of 19.2.2. So I can enter 1 there. If I didn't qualify for the full measure points for either of these two, I could enter up to 2 QAPI points here as well. I'll upload my documentation and save and continue. Measure 20, the tool that's associated is going to be the staff retention calculator. So jump back. In my table of contents, find the staff retention calculator. And as I mentioned before, at first I'll only see fields A through C. So I'll go ahead and enter the total number of staff on the roster at the beginning of the year, say is 108, and then the total number that still remain on the roster at the end of 2025, which let's say that was 92. So at this point, my retention percentage is over 60%. So at this point, I would be done with the measure or the tool. And then let's say that maybe instead of 92 staff still on the roster, I had 58. So at this point, my retention percentage is between 40 and 60%. And because of that, I'm then going to see fields D through F to see if I qualify for points under staff retention improvement. So field D is already filled out. I just need to enter in the staff retention calculated for the prior year. So in this case, let's say that was 48%. And then it's going to show the percentage improvement, which in this case is 5.7%. So at that point, I can save that and jump back to measure 20. Indicate if I am applying for points. Since I applied for the measure points, I can't apply for any QAPI points, and I will upload my support as well. Measure 21, we'll say we are intending to apply for points, and the tool and calculator for this measure is just on the same page. So this is going to be a case where you do need to enter a full 4-character year. It needs to be exactly in this format here to calculate DON or NHA retention. So let's say our DON is John Doe, and he was hired for 2023 and started in the DON position at the same time. So you'll notice here, I don't have 2 characters for the month. And when I try to hit save and continue, you'll see how that errors out. But at this time, it looks like he's only been the DON for 2.7 years, not 3 as required for points. So let's try the NHA, Jane Doe. And we'll say she was hired 12/31 of 2020 and moved into the NHA position at 12/31/2021. So she's been retained for 4 years and would qualify for points. So we can come up here and score the points there. And then when I try, well, let's attach our support first. Attach my support. And then when I try and save and continue, you'll notice it asks me to enter a valid form of the date. That is just because I don't have 2 characters for my month. But once I correct that, it should allow me to save and continue. So now we're on to measure 22, and this requires the staff turnover calculation tool. So I'll jump back, go to my table of contents, and staff turnover calculation tool. Okay, and then all I need to do is enter the total numbers of staff at the end of quarter, or at the end of 2024 and the end of 2025 calendar years, the number hired and the number terminated. So go ahead and enter that. And you'll notice as I entered all of that, it updated these calculations below. If you get any that say this is not a number, it just means one of the figures is missing from above. So once I've filled that out, go ahead and save it and jump back to measure 22 and finish assessing the points for that measure. Attach my support and continue. So for measure 23, this is going to utilize the behavioral healthcare tool as well as the training attendance tool. So what I'll do first, go back. And from my table of contents, I'll come to the training attendance tool. And then below the section that refers to measure 6, these tables refer to measure 23 and behavioral healthcare trainings. So the required mental health 101 training, I'll go ahead and enter my information for that. So let's say the dates of the training, there were 2. So 1/1/25 and 6/25/25. And the number of admin staff who attended the first one, so there were 2, 1 social services staff, 4 nursing staff, 0 other staff, and then the total number of nursing staff in the home at the time, let's say that was 26. So as soon as I click out of that cell, it's going to calculate my average at this point, and we'll go ahead and enter the numbers for training 2. and it should update all of the sums and the average as well. Now, again, I'd like to reiterate, please only enter information in the columns that are needed. If I went through and entered a 0 in any of these other training columns, it wouldn't affect the sums necessarily, but it will throw off the average and decrease it, because then it is dividing by 3 instead of by 2. So only fill out the columns that are actually needed. And then I'm going to select the 2 other trainings from the remaining options, so serious mental illness and substance abuse. And then you'll see that those 2 tables are now visible to me. So I'll go ahead and fill those out. We'll say we only had 1 training for each of those. So July 17th, there were 2 admin staff, 1 social services, 26 nursing staff, and 1 other staff that attended that training. And there were 34 nursing staff at the time. And then for substance abuse, there was 1 training on the 26th. And then the number of staff that attended that one. And the number of staff employed as nurses or direct care staff at the time. So once all of those have been completed, I can save and continue, and it will pull all of those sums and averages over to this behavioral healthcare tool. And it will populate as well the percentage of nursing and direct care staff that were trained. So the only thing I would need to enter here is going to be my dates at this point. Once I finish that, I can save and continue. I'll go back and in my table of contents, jump back to measure 23 and use the results from those 2 tools to inform the assessment of points here. Attach support if needed. And then once I save and continue from measure 23, it will show me a summary of all the points earned for the quality of care domain. If you go back and change any of these figures, they will change on this page as well. At this point, it looks like we're earning 32 total points for this domain. And then once I save and continue, it will take the total points earned for each of those domains and sum them together across the entire application. I save and continue from there. We'll go ahead and progress to the final review, which is going to be the last item on the table of contents. So at this point, we'll say that I filled out everything I intended. We'll ignore measure 5 right now, as I'm going to use that for an example in a second. But what I'll need to do is go through each measure, check that the score appears correct, and that the number and titles of the uploaded files appears correct as well. And then initial complete on all of those. So we'll go through, and if everything looks correct, I'll sign off. We'll say that maybe when I get to measure 10, I noticed that, oh, this should actually be scored for 3 points. So at that point, I can jump back to, I'll go back and jump back to measure 10 in my table of contents. And I'm going to update this so that I do intend to apply for points in the full 3 points. And upload any documentation that is needed. Then when I save that, it will take me back to this final review. I can finish reviewing and signing off. It will require that I fill out and sign off on each of these before I can save this page. As well as the total. And then when I click save and continue, now it's going to show me my final table of contents summary since I've completed that final review page. So at this point, it's letting me know that I did not finish measure 5 or I did not save it. So at that point, I'll come back to measure 5, mark that no, I don't intend to apply for points, save that, and then that warning should go away. So at this point, I have not yet submitted the application. I have filled out all of the pages, as you can see by the blue check marks. And then this is my last chance to go back and review all of the information if I need to. So once I've gone back and reviewed and everything is complete and I'm ready to finish submitting the application, what I'll need to do is click Save and Continue on this page. Once I do that, I'll not be able to make any further changes. And then it takes me to the attestations. I'll need to enter my name, title, and the date, and that will need to be in that 4-character year format. So it's December 3rd. And if I try to click submit without checking the attestation box, it will not let me go forward. So I'll need to check that I attest that all the information is complete and accurate before clicking submit. So now at this point, the application is submitted. I see this response that says my response has been recorded. At this point, the application has been submitted for consideration. And at this point, I'll also receive a summary of my application responses. So here's to give you an idea of what that looks like. It comes from Myers and Stauffer at that no reply queue email server address. And the formatting is sometimes hard to read. So if you want to see a better formatted version, you can click on these links at the top and it will open in a new web page that is just a little bit easier to read and look at. If you need clearer formatting as well, you can reach out to us. We can provide a PDF summary that will look more like how you viewed it as you completed the application. You'll also notice that wherever you uploaded documentation, if you try to click on those links, it's going to ask you to sign in with a Qualtrics account. And that's just because if PHI is being uploaded, it's not really a secure way to let anyone access that. So if you need names of the files that were uploaded, just let me know. I can send you a summary of that information, but you won't be able to access it from that email. Okay, so that kind of completes my walkthrough of the process. And then are there any questions that I missed in the chat? Okay, it looks like Matt was able to get to most of these.
Yeah, I think we answered all the questions in the chat, folks, but so you'll be uploading, I see the question that just came in. You'll be uploading documents to Qualtrics and not to the Coltco website for your application submission. It's all going to be done in that same space. So you won't have to be doing the 2 different websites for your application submission.
All right. Answer, if there were trainings that were just available at any time during the year, Matt, can you speak to that?
The asynchronous trainings that come in, there's generally 2 ways you can go about it, and certainly love to hear what others of my colleagues think as well. You would want to know when those were completed by the staff so that they, you knew they were done and completed. So you'd want to track those dates. Those were done. I believe it is possible, if it was done over a period of time within those boxes, to say a date range. For like it was done in a month. I think you can probably, I said we can't put a dash in a box, right, Charlotte? But if it was all completed in December of 2025, could they put 12/25?
On the training attendance tool, yes, they would be able to do that.
Yeah. And so if you had 10 people complete it in August, just put August 2025 and don't put an actual date if they were completing it all throughout the month. And then if you had another group that completed those asynchronous trainings in September, you would put September and then list all the people who took those trainings and the number of staff for that month.
All right. I'm not seeing any other Qualtrics questions at this point, so I'll go ahead and hand it off to Jennifer.
Yeah, I see one more question. I'll answer it as we transition. The name and qualifications of the infection preventionist. At this point, folks, we're wanting you just to tell us what that training is that qualifies them to be your infection preventionist, and that the trainings they have are current in the sense that they're qualified to serve that role. We do not have strict parameters on like an annual training or every 2 years at this point in time. As long as the training is still relevant, then it can be included.
Thanks, Matt.
Hmm?
I will share my screen again and go back to this slideshow. Okay. I just wanted to talk a bit about prelim review and appeal submission. So to answer Rhonda's couple of questions on will we be uploading to another website, you will not for the initial application submission, because that will be closed on March 1st. So you will not be able to use that link beginning March 1st, since the deadline is February 28th. So as you know, Myers and Stauffer does a very quick preliminary review of those applications. And what we're looking for is some obvious documents that were not uploaded that we absolutely need in order to complete our review. The big one and the most common one that is missed is your CASPER reports and your independent survey. So if we contact you and say, you did not upload your independent survey, please submit it in the next 2 days, or your CASPER report, please submit it in the next 2 days, you are given a few options for sending us documentation. You can directly email Colorado P4P@mslc.com if there is no PHI included in your email or your documents. You can also use your own organization's secure email service if you have one, and we will log in and get those documents from you. Or you can upload those documents to COLTCO, which is the mechanism we used in the prior year to upload all documents. The website is here. And if you need immediate access, please email the Colorado P4P@mslc.com. That comes to my inbox. I monitor that, and I can set you up as quickly as possible to upload those documents. Access to that P4P page on this website here will open on March 1st. And the following screenshots, I just want to walk you through how to upload to that particular page. If you're familiar with COLTCO, you're also able to upload to the typical I'm responding to an audit request that we use for our NIF cost report process. So you can either use this mechanism or that other avenue on COLTCO. Provider Plus P4P access is required to upload documentation. If you responded to the email asking for primary, secondary P4P contacts, a request form is not necessary. That was true last year. And if you still have access, you still have access, and we have not cut that off. However, if you've never had access to COLTCO, you can send it to this COLTCO accounts MSLC, or like I said, you can send it to Colorado P4P@mslc.com. This is the homepage where you would log in. I'm going to go through these pretty quickly because we are recording this session, and we will send out these slides to you as well as the recording link. This is the welcome page. So you can go to this pay for performance option, and check the box for which measure you want to upload documentation for. And then you can choose which piece of the measure that you want to upload for. It doesn't matter though, if you mess this up, we'll still get your document. So if you choose 2 bathing care plans and you meant to upload the narrative, we'll still get your document. So keep that in mind. This is kind of a demonstration on how to upload multiple documents. And you can choose multiple files at one time by holding down the control button while selecting. And you can see the files that you're about to upload here, and then submit documentation. And then you'll get this message that says successfully submitted. If it's something as simple as a Casper report or an independent survey, I would just email it or use your own secure server email. That may be an easier option than going through this process. But it is here for you if you need it. And you'll get this confirmation code.
Yeah, thank you, Jennifer. I think this will become important for us during the appeals process. So we'll make sure we get this information back out to you. Again, remind you of this as we hit the appeal period, because that's the situation where you're likely to have documents or explanations that may contain PHI. And in those instances, it's got to be the secure email that you have. If you have an SFTP or secure email system. If not, you'll need to utilize COLTCO, because oftentimes during the appeal, you're providing the clarification, but sometimes that clarification, even if it's written, still contains PHI in it. So you want to be mindful of that, especially during the appeal period.
Thanks, Matt. I will jump to application changes if nobody else has a question. Eva, I will go over the key dates, or Matt will go over the key dates after the P4P committee slide. You can pitch it back to me, Matt, if you want to. But first, we're going to go to the application changes, if that's okay. So application changes from current year 24 to current year 25, or calendar year 24 to calendar year 25. There is a 2-page PDF summary located on the HCPF website. And when we send you this slideshow, it's a live link, so it'll take you right to that 2-page summary. And as a reminder, homes with substandard efficiency are still eligible to participate. You'll just receive half of the calculated payment. So allocated points allocated to each measure and domain are the exact same as last year. A quick shout out to measure 16. It is still 3 points total. However, there'll be 1 point for the contributing factors section and 2 points for the root cause analysis section, which I will show you in just a moment. But everything else is the same from calendar year 24 points wise. For measure 12, minimum requirement 12.1 has been changed from requiring contact information to now requiring documentation of 2 group InReach presentations hosted in your home. And that documentation must show the dates of the presentations and the format of the invites for the residents and family supports. Minimum requirement 12.4 has been clarified that the requirement is to provide care plans that demonstrate examples of 4 current residents transitioning out of nursing home care or to a lower level of care. I don't think the current residents was very clear in last year's application, but that's what the department is looking for there. On minimum requirement 12.5, it has been clarified that the requirement is to provide care plans that demonstrate examples of 4 previous residents of the nursing home that have transitioned out into the community or to a lower level of care. And for both 12.4 and 12.5, if the home does not have 4 examples from either 12.4, which is current residents, or 12.5, which is previous residents, any number of examples from either section can be used for a total of 8. So if you have 3 examples for 12.4 and 5 examples from 12.5, as long as it's a total of 8, that will be acceptable. For measure 16, it has been restructured completely. Due to data taming and availability issues, nursing homes will collect their own data and implement action plans to reduce hospitalizations in their home. So 16.1 has been updated to reflect the change in data retrieval by the department to rather the nursing home tracking long stay transfers to hospitals and providing details on top 5 most frequent transfer reasons based on the nursing home medical records. Minimum requirement 16.2 has been updated for the nursing home to perform a root cause analysis and identify major contributing factors related to those hospitalizations, along with other analysis. And then here is what measure 16 looks like now. So there's this chart that is duplicated in Qualtrics. Charlotte went over this measure in detail a few minutes back during her live presentation. So that would be a good thing to watch again if necessary. But this is what the Excel application looks like. 1 point for this written narrative and these figures here, and 2 points for a written root cause analysis. For measure 17, it is the same as last year. Please don't forget to submit your CASPER reports, because this is worth a lot of points if you did really well on the measures that are, or on the QMs that are being measured. That's 20 points. So that's a big chunk of the application, plus the 1 point for the narrative. So we've added some resources for measure 4, connection and meaning, and measure 5, person-directed care. And those resources were added in Appendix 7 for both measures. So please take a look at that on the Excel document. And for measure 19, antibiotic stewardship and infection prevention and control, resources were added in Appendix 6. Are there any questions before I hand this over to Matt? I'm sorry, I can't see the chat at the moment.
A question came in around the care plans. When we say current residents, current as of when we pull the care plan or the end of the year. It's a great question. It would be a resident that would have been there during the performance year, so calendar year 2025. But if they're still current, still there, it's still okay. But we don't, we're not looking for information on folks that were not in the home during the performance year.
Okay. Any other chat questions? Okay, Matt, I'm going to hand it over to you. What I think we have next are just a few slides where you can just talk about the Pay for Performance Committee and go over some key dates.
Yeah, absolutely. Yeah, go to the next slide. Or is this all the slide we have on the Pay for Performance? Yeah, before we get to key dates, just a reminder, folks, we do have the Pay for Performance Committee that we work with folks who are managing this program for their homes, or in some cases, management companies that have multiple homes. It is an open committee. And so anyone who's interested in participating and being a part, you actually get to be a part of the decision making each year around how we improve the measures, how we clarify them, and also what measures we pursue and retire and look forward. We're always trying to look at can we be performing better as a state? What do we know is coming from CMS? We want to use this program to help folks get prepared for ahead of time. Where are there innovative practices that best practices where we can build some structure to help folks be able to move into some of those innovative spaces? And so please, if you're interested, reach out. We'd love to have you on the committee. In terms of our key dates, we're having our training session here today. We anticipate the launch of the application to not be any later than January 2nd of 2026. Of course, we're not going to wait to that date. If we're ready to go, we're going to get it out. But as you can see, we've made a lot of updates to help make this more user-friendly for you. And so we want to make sure that that development process goes smoothly and that it is ready without any bugs for you all. Still gives you 2 months there to complete the application. We encourage folks to go ahead, as Charlotte mentioned in the demonstration and the overview, start organizing your documents. Get your folders together, start naming your documents, get them all there. If you have multiple documents for one measure or for one minimum requirement, start pulling those zip files together so once it is open, everything's there. And I know that in some cases, folks use the actual Excel application during the year to track and keep track of their narratives or numbers. The cool thing about Qualtrics is you can actually go and copy that if you have a Word document or in that Excel application, you can copy that and paste it into the narrative box in Qualtrics. So those things allow you to do some work up front so that you're ready to just input this in the 2-month period from January through the end of February. We'll begin those reviews as soon as that end date starts. That starts with that preliminary review that Jennifer was telling you all about. And then we work through those as well as we do the on-site reviews as well. And we hit those in April, with the expectation that we'll release results to you all on May 1st, which at that point in time opens the appeal period that will end on May 15th. So we have a 2-week window. We've kept that open for an entire month in the past. Generally not the practice for the department, and we know that folks generally have waited to kind of submit some of those appeals. But it's also delayed us in terms of finalizing scores and being able to get it into the model so we can get you your payments out as we get to July 1st. So that window is May 15th to get those appeals in. Get those in, make sure you review as soon as those scores are released to you. If there's something you think we've made an error or misinterpreted something, you need clarification on it. We don't accept new documentation. Then it's hey, I think you didn't interpret what I uploaded correctly. I think I should have been awarded points here. Send in that appeal. We'll take the review. We'll make the decision, get that back out to you. And we generally try to finalize scores as we head into June and get all of that finalized and get that out to you all so that we can also get it into the model and be able to get those payments calculated for you. Any questions there? Okay, again, we'll have our contact information available here on the slide. If it's program related, a question about what's really required, reach out to myself or to Richard Clark. If it's kind of portal related, technical, how to use Qualtrics, how to submit files, when we get into preliminary reviews and appeals, certainly reach out to Colorado CO P4P at mslc.com. Well, that concludes the material that we have for today. I want to thank the Myers and Software team for pulling this together and walking us through the Qualtrics. I'm really pleased with where this has been enhanced, particularly around the file upload piece, but also in little places you're going to see, whether it's the calculation tools, the flow, the error messages. We want to make sure that we score you for what you deserve and what you've earned, and that we minimize that potential for administrative error as much as we can. So hopefully you'll find that in this year's application. And if you are having any troubles, any questions, reach out early. Give yourself some time. Make sure you're feeling good about your application. Reach out, get it done, and try to get it done with some space there. There are instances where we've seen where something is submitted and it comes in and it's attested, and then 3 days later you find out something was a completely wrong file or in error. If we got time, we can work with you. We can get surveys open and things like that again. If it's if it's 11:59 on February 28th, there's not much we could do. And so just make sure you're getting ahead of it, and reach out for assistance, because the more we know ahead of time, we make sure we can provide whatever resources we can to help you feel confident in your submission and get you through to the deadline there. We appreciate all that you're doing in this program. Again, as I said at the beginning, this is one of the best programs in the country, and I think it's really built a culture here in Colorado around our care in the homes and how we approach that from a resident-centric place and an innovative space. So we extremely appreciate your participation in this program. We appreciate all that you're doing to help folks thrive and stay healthy and safe within their homes. Please do the same for yourselves. Take care, everyone. We'll get these slides out to you all and up on our website and the reporting as well, just as soon as we can. And happy holidays, folks, and good luck on the application. We'll talk to you again real soon.